Most people believe that if a doctor recommends a treatment, it must be safe. The tests are done, the prescriptions are filled, just follow the plan. I used to believe that too, until I started counting the people who trusted every word, every protocol, and came out shattered, not better, destroyed, changed forever. A man who followed the routine for his heart and ended up in the ICU, barely recognizable. A woman who stuck to every guideline and lost 6 months of her life to complications nobody warned her about. Months of strength, independence, and memories gone. Here's the truth nobody tells you. The older your body is, the harder it fights. Not the disease, but the treatment itself. Medications that seem harmless can crash kidneys. Procedures that seem routine can steal months of life. And even when everything goes as planned, your body may never be the same again. These are decisions that carry hidden risks, silent dangers, consequences that can destroy your life quietly, invisibly, and permanently. Most doctors do not fully explain this. They will not. And that is why you need to hear it now, before it is too late. I have spent over 2 decades in hospitals watching patients make choices that seemed safe and watching their lives change forever. I have seen firsthand how age does not just slow the body, it magnifies risk, amplifies consequences, and punishes decisions that younger bodies simply shrug off. Today, I am going to tell you the truth about 5 medical decisions. Decisions that seem right, but that I would never let anyone in my family make after the age of 60. Decisions that carry silent, hidden dangers. Decisions that can quietly steal independence, months, even years of life. All while everyone around thinks everything is fine. Think of it this way. You would not stress a brand new car the same way you would stress one with 200,000 miles on it, right? And yet, medicine often treats a 70-year-old body the same way it treats a 40-year-old one. Same medications, same procedures, same recovery expectations, but the older body is a fragile machine, and every choice matters more than anyone wants to admit. Here is what nobody tells you about aging and medicine. As we get older, the body's defenses do not just weaken, they falter in ways that are not obvious until it is too late. The heart struggles to keep up. The kidneys slow down, struggling to process even standard medications. The lungs take longer to clear treatments, leaving patients vulnerable. And the brain can spiral into confusion, disorientation, and memory lapses that last weeks or months. Doctors call it post-treatment cognitive dysfunction. But for families watching from the outside, it feels like the person they knew simply vanishes. Age itself is not the enemy. There are patients in their 80s who bounce back faster than some 50-year-olds. But frailty is real. Frailty is not a number on a chart. It is the body saying it is running on borrowed strength. Roughly 40% of people over 75 show signs of frailty. By 85, nearly 60% do. And here is the hard part. Most people only hear about survival. Will the treatment work? But that is only half the story. The real question is whether the patient will survive the aftermath. Because surviving a treatment does not mean life goes back to normal. Surviving the treatment is just the beginning. 1. Following aggressive heart treatment plans without questioning alternatives. Everyone assumes that if a cardiologist recommends a certain protocol, especially for heart disease, it must be the right path. Tests are done, medications prescribed, procedures lined up, everything looks neat, professional, controlled. I used to believe that too until I started keeping track, counting the patients who trusted every instruction, every guideline, and came out permanently changed. Not better, changed. Broken in ways nobody warned them about. A man in his early 70s followed every pill, every lifestyle adjustment, every checkup. 6 months later, he was in the ICU with severe kidney failure triggered not by the disease but by the treatment itself. Another patient, a woman in her late 60s, stuck to every heart guideline her doctors gave her. 6 months later, she was not just exhausted, she had lost months of her life to complications nobody had prepared her for. Months she would never get back, memories she might never recover. Here is the brutal truth. The older your body, the harsher the impact of treatment. Not just the disease, the treatment. Aggressive regimens can overwork the kidneys, stress the heart, inflame the liver, and scramble the brain. Organs that younger bodies shrug off suddenly fight for survival, and most patients never hear this. Doctors focus on curing the disease, not on protecting the patient from the treatment itself. Ask yourself this question. Are there gentler paths, less invasive options that protect the body while still treating the condition? Sometimes the safest choice is not the boldest one, it is the one that respects what your body can truly handle. Before agreeing to any aggressive cardiac protocol, ask your doctor what happens if you take a more conservative approach. Ask whether there are newer, less taxing alternatives. Ask what the realistic recovery looks like for someone your age, with your kidney function, your other medications, your daily reality. The answer to those questions could change everything. 2. Elective joint procedures and aggressive orthopedic interventions. Most people think that if their knees hurt or their hips are stiff, a replacement will fix everything. It sounds logical. Painful joints, limited mobility, surgery seems like the guaranteed solution. But here is the truth I have seen over and over again with patients over 60. Elective does not mean safe, it means planned. And a planned procedure can still destroy months of life if the body is not ready. Consider a woman in her late 60s who had both knees replaced within a single year. She followed every instruction and prepared herself perfectly. After surgery, she developed deep vein thrombosis, then a pulmonary embolism. Weeks later, she could barely walk. Her life, her independence, temporarily stolen. Another patient in his mid-70s had a hip replacement without proper pre-surgical preparation. His heart struggled under anesthesia. Pneumonia set in. 3 months later, he was still in rehabilitation, weaker than before he ever went in. Elective does not mean harmless. An older body resists trauma, blood clots, infections, heart strain, lung complications. These are not minor inconveniences. They are life-altering consequences waiting silently in the wings. And too often, patients never ask the crucial questions. Is this the right moment for my body? Could physical therapy, targeted injections, or gradual strengthening offer the same benefits without risking months of recovery? Sometimes the smartest decision is not the one involving the biggest action. It is the one that honors your body's limits, that keeps you moving safely without paying a hidden toll. Before scheduling any elective joint procedure, demand a full conversation about timing, about your cardiovascular readiness, about what happens if something goes wrong, and about what genuine alternatives exist. You deserve that conversation before signing anything. 3. Aggressive cancer treatments in older adults. Cancer terrifies everyone. When you hear the word, the instinct is immediate. Cut it out. Attack it. Do everything possible, and that instinct is understandable. It comes from a place of fear and love and the desperate desire to survive. But here is the brutal truth most people never hear. The most aggressive treatment can sometimes steal more life than the disease itself. Consider one of the most complex surgeries for pancreatic cancer, a procedure that involves removing part of the pancreas, the small intestine, the gallbladder, and the bile duct. 6 to 10 hours of precise surgery requiring enormous physical stamina. For a healthy 50-year-old, it can be life-saving. For an 80-year-old with heart issues or mild kidney dysfunction, it can become a ticking time bomb. Infections, organ failure, extended ICU stays, post-operative cognitive decline. The patient might live 6 more months or not at all. That is not pessimism, that is the data. 1 in 5 elderly patients undergoing major surgical resection experiences what doctors call failure to rescue complications. Their bodies simply cannot survive. The question almost nobody asks is this: if I do not operate, what other paths exist for someone my age and health status? Radiation, targeted therapies, watchful waiting. All of these may offer years of quality life instead of months trapped in hospitals, weak and frail. Cancer does not have to be a battle where the body pays the full price. Sometimes the wisest decision is choosing a strategy that protects life rather than simply attacking the tumor. Quality of life is a medical outcome too. It belongs in the conversation from the very first appointment. If your oncologist is not raising it, you need to raise it yourself. Ask what treatment looks like not just on paper, but in daily lived experience for someone your age. Ask what the realistic odds are with and without aggressive intervention. Ask what a less aggressive path actually looks like. These are not defeatist questions. They are survival questions. 4. Aggressive preventive screenings in frail older adults. Routine screenings feel safe. Colonoscopies, full body scans, extensive blood panels. They are supposed to catch problems early. Everyone tells you it is just preventive. It is for your own good. It sounds logical. But for frail patients over 75, these procedures can trigger serious complications that no one talks about. A woman in her late 70s, careful with her diet and active in her community, was scheduled for a routine colonoscopy. She seemed healthy until the preparation process and sedation taxed her kidneys and heart. She ended up in the hospital for a week with dehydration and dangerous confusion. Another patient in his early 80s went in for a full body scan. The procedure itself went smoothly, but the follow-up biopsies, the false positives, and the months of anxiety that followed fractured her independence and peace of mind in ways no one had anticipated. Here is the brutal truth. In older adults, more testing is not always better. The body does not bounce back the way it used to. Sedation, contrast dyes, even minor interventions can tip the balance from stable to critical, and yet most patients never hear that question asked plainly. Is this procedure actually beneficial for me at my age with my specific health status? Sometimes the safest decision is to pause, to weigh the value of the information against the genuine risk of harm. Preventive care is not bad, but for frail older adults, it must be personalized, not rushed, not routine, thoughtful, cautious, and brutally honest. Ask your doctor who specifically benefits from this screening at your age. Ask what the false positive rate is and what happens next if something unusual shows up. Ask whether the preparation process itself carries risks for your kidneys or heart. These are reasonable questions with potentially life-changing answers. 5. Emergency abdominal surgery. This one is not planned. It hits fast. A ruptured appendix, a perforated bowel, internal bleeding, sudden and terrifying, leaving almost no time to think. And here is the brutal truth most people do not understand. For patients over 75, emergency abdominal surgery carries some of the highest mortality rates in all of medicine, between 30 and 50% in severe cases. Not because surgeons are careless, far from it, but because an older body under sudden trauma is fighting on every front simultaneously. Heart, lungs, kidneys, liver, all taxed at once. A man in his late 70s arrives in the emergency room with severe abdominal pain. The scan confirms a perforation. Surgery is urgent. He survives the operation technically, but days later his kidneys begin to fail. His lungs struggle. His mind drifts in confusion and delirium. Weeks of rehabilitation follow. Months of independence vanish. What looked like a routine emergency becomes life-altering or life-ending. Here is the point most families never hear in time. Knowing the risk before it happens is life-saving. Conversations about advanced directives, realistic outcomes, and what quality of life truly means are not morbid conversations. They are essential ones. It is not about fear. It is about control and preparedness. Before any emergency strikes, have the hard conversations with your loved ones. What outcomes are acceptable? Which complications are deal breakers? How much intervention is truly worth it given what kind of life follows? These discussions cannot happen in the panic of a hospital corridor at 2 in the morning. They have to happen before the crisis, so that if your body is under attack, your wishes guide the care rather than assumptions or default protocols. Early recognition matters enormously. Persistent abdominal pain, bloating, changes in bowel habits should never be ignored after 60. Seek an assessment early. Intervention in a controlled setting drastically reduces the hidden risk. And always have a clear, documented plan with your family. It can literally save the life and dignity of someone you love. Now that we have walked through these 5 decisions, let us talk about what you can actually do with this information. Because knowledge alone is not enough. Without action, it is just fear. And the last thing anyone needs is anxiety without a path forward. Before any major medical decision, ask the right questions and write them down. Ask your doctor what happens if you do not proceed with the recommended treatment. Not in theory, not in average statistics. For you, right now. If the answer is nothing urgent in the next 6 to 12 months, you have time to think, to get a second opinion, and to optimize your health before committing. Ask whether there is a safer or less invasive alternative. Medicine has changed drastically in the last decade. Treatments exist today that did not exist a generation ago. Catheter procedures, targeted therapies, guided physical therapy. Ask for them. Demand to know about them. Ask what recovery will genuinely look like for someone your age and health profile. Not the average patient. You specifically with your heart, your kidneys, your medications, your living situation. The answer should be precise, not generic. And ask your surgeon or specialist for their personal complication rate for patients like you. Surgeons track this, they know their numbers. If they hesitate or deflect the question, that itself is a red flag worth paying attention to. These 4 questions are your shield. A medical recommendation is not a verdict. It is the start of a conversation. And the person with the final say is you. Your age is not a weakness. Your body may be older, but your mind, your choices, and your voice are entirely yours. Every recommendation is a starting point. You have the right and the responsibility to ask the hard questions, to request alternatives, and to take the time you need. Your choices, made with full knowledge and clear eyes, are the most powerful tool in medicine. You hold that tool, not the prescription, not the test, not the procedure, you. And if anything shared today helps someone you love think more clearly before a major decision, share this with them. That one conversation might be the most important thing you do today. Stay alert, stay curious, and never stop asking why.